Effects of holding onto urine for too long. A lot of people have different reasons why they are holding onto their urine for a long time. For instance, when you are out, some people don't feel comfortable using other people's convenience, or there's a particular task you're working on, you just want to finish it in a particular frame of time. So even if you are pressed, it can't distract you. You prefer to hold it in till you're done with whatever you are doing before you go to urinate. But whatever may be the reason why you are holding back your urine, it is not advisable. Let's look at 5 effects of holding back your urine. Number 1, urinary tract infection. If you hold your urine for too long, you are in a higher chance of developing a UTI, that is a urinary tract infection. Our urine are not sterile, they naturally contain bacteria, although in small quantity. So if the urine stays back in your bladder for too long, they tend to stay there and multiply. After the multiplication is being made, it then leads to UTI, which is urinary tract infection. Number 2, it can cause your bladder to stretch. Once your bladder is stretched, it makes it to become weak. Usually, when urine fills up the bladder, it stretches, and when you are done passing out the urine, it bounces back to its normal shape. Now, continuous stretching of the bladder by holding in your urine can make the bladder not to bounce back to its original shape. And when this is done, you may not be able to pass out urine on your own without the use of catheter. Number 3, it can result to kidney stones. The urine you pass out contains calcium oxalate and uric acid. All the blood in your body are filtered through your kidney, and metabolic waste from your blood are being excreted in your urine. If you then hold back your urine for too long, it will stay there and form crystals in your kidney, giving rise to kidney stones. Then from kidney stones, kidney disease or kidney failure. Number 4, it damages the pelvic muscle. One of the pelvic floor muscle is the urethral sphincter. What it does is it helps to keep the urethra close to prevent urine from leaking out. That is why you have the ability to hold on to urine for a while, because your pelvic floor muscle is active. But if you keep holding in your urine for too long, that muscle may become weak. And when it becomes weak, it can cause leakage. Like you will be in a position where you will not be able to hold on to urine anymore. So once your bladder is full, it will start leaking out of the urethra, just like that. And lastly, number 5, holding onto urine can burst your bladder. Bursting of bladder actually is rare, but it is really possible. If the bladder bursts, the urine fills up the entire abdomen, and when this happens, it is only surgery that can fix it. So you see, whatever may be your reason for holding in urine, it is not advisable. Always try as much as possible to pass out your urine wherever you find yourself. This is to avoid any of these things I have just mentioned.